and wanted to update you on the dental chair potato in my first month's experience. The biggest difference in my mind is ergonomics for me and the patient. Those are the biggest differences. For example, when the patient's laying in the chair, they see the TV show images, the DVD player, the patient education, the radiograph, the dentistry I'm showing them, the image I've taken of their mouth, without moving. But the big thing is that so do I. When I have a set of x-rays in the patient's face, I don't have to turn to the monitor on the right or the monitor behind me. The patient doesn't have to look up to the monitor on the ceiling, look around me. I don't have to move them. I don't have to move me. Doing periodic exams and having bite wings on the screen and not having to turn to see them, to be reading them while I'm looking at the exam and just lifting my head, is amazing. I'm used to turning around or looking at the computer on the other counter or the one behind me, depending on which room I happen to be in. One of the common problems dentists have is we have to retrofit offices. You don't decide to put technology in the treatment room and then decide, I'm going to go buy or build a whole new operatory to accommodate my computer. We don't do that. That's not reasonable. So probably 99% of dentists already have a practice, aren't building a new one. Now they add technology, where do they put it? So what I see happening is most of us want to put it behind the patient. It's private. It's our private area. HIPAA regulations. Patients shouldn't see what we're doing with other people. So we put it behind us. Well, you know, a lot of us have stuff behind it. We don't have cabinetry for it. We don't have the shelving for it. We don't have the drawers for it. So now where am I going to do it? Well, I might put it on the dentist side of the room, on a cart or on a cabinet. Fine, except when my assistant needs it. My partner put one on the assistant's side. Well, when I used his room, would look at his x-rays, I'd have to get up and walk over there or look across the room and tell the assistant, blow that up for me. Now retrofitting becomes easy because you add the dental chair potato. Now it's ergonomically correct no matter where the other monitor is in the room. So retrofitting, it's a blessing to retrofit a practice. Why would I bother when I already have a dental light? Why would I do it? Well, ergonomics would be my reason today. It wasn't when I first heard about it from you. It was because entertaining patients, letting them watch TV, and I didn't really realize what that did mean too. It's not just for me, but it also is important for them. So what I've learned from my patient comments are things like this. The impressions don't take as long because I'm busy watching the Olympics, watching the news, watching the soaps. Waiting for me when I'm out doing a hygiene exam and I get stuck with maybe 2 hygiene exams and a phone call from a dental society, for example, and I sneak away in a corner. Patient doesn't realize how long I'm gone because they've been busy. They're not timing it. So time goes faster for the patient during it. So that's a benefit of having this type of diversion for them. One patient said to me, boy, I'm so less stressed with this here. My question was, why? She says, I have no idea. It's not important why. She was. This is an absolute true story. She said to me, I was thinking about this visit all day. Then I saw this, and I wondered why I was so nervous. Well, what's that about? Well, not important. It's the effect it had on her.